So what were you saying about your body weight? It's a
modulatory factor of the positional dominance. If you increase your weight, if you are a positional patient, and you increase your weight, you will become non-positional. So you will have apneas and hypopneas also in the lateral posture. But if you are non-positional and you decrease your weight, you have a good chance to become a positional patient and then to use this system to avoid the supine posture and sleep well in your lateral postures.
And you did a case study on this? Or?
It's not case study, it's a follow-up study of 112 patients.
Wow.
That I recorded twice in the sleep lab, and we look for the change in body weight and positional dominance, and that's our actually the conclusion of our study, that the lateral AHI is the more sensitive parameter that tell us if you will become positional and non-positional. Okay? If you increase your weight, the lateral AHI will increase too. You decrease your weight, the lateral AHI will decrease too. The supine AHI is worse all the time. Yeah. So you understand?
That I completely understand.
Okay.
And so when you look at the patients in your study with positional component as a decreased body weight, they're still not doing anything, right? They're not adhering to any therapy?
No, they try, at the beginning they try CPAP and didn't like much, and they look for another type of therapy. And when they realize that if you decrease your weight, you can sleep in your lateral postures, right or left, without major problem. It's a solution. It's not a radical solution, but it's a partial solution that can give you good results. But you have to test that. You have to check if you are positional or not positional. You cannot, without checking that.
You have to validate it.
That's right. You have to validate and to evaluate which kind of guy you are. Okay?
Yeah.
That's right.
And so, in terms of treating these patients with positional apnea, what do you tell them to do? You tell them to sew a tennis ball into their t-shirt?
Yes.
Do you find that works, the tennis ball?
It works. It works mainly for the older guys. The young people don't like. It's not comfortable, so they throw away after few weeks or few months, and sometimes few days.
Yeah.
Okay, because it's not comfortable. But some of them learn just after a few weeks, to go left and right, and they don't need to use it anymore.
They train themselves.
That's right.
Yeah.
But up to now, I didn't find which are the patients that will learn and which are the patients that won't learn.
Yeah.
So
it's a hard predictor.
That's right. It's difficult to predict which one will learn and which not.
Yeah. Would you see the Remedy as being a viable treatment solution instead of the tennis ball?
The what?
The bumper belt?
Well, I haven't used it, but it looks looks better and more comfortable than the tennis ball, so probably it would be.